In all of these situations, storytelling was about finding the courage to speak up, even when it might be quite hard to do so. Remember that it can be helpful to work together with others, especially in a coalition. While not all stories put our very lives at risk, some stories can put our livelihoods and reputations at risk when we are shining a light on problems in the system. Let's hear from a former CHW, George Mwinnyaa, on how he's encountered this in his own career.
Hi everyone, my name is George Mwinnyaa and I'm from Ghana, West Africa. I was a community health worker in Ghana for several years. That was from 2007 till about 2012 when I left Ghana. As a community health worker, my main job was to provide all forms of services to very remote villages. And today I will share an experience from one of my work. So in Ghana, and this may be true for some other parts of Africa, we have a day called National Immunization Day. And this is when, usually as a community health worker, we are invited to a sub-district, receive a one-day workshop, and after that, they will give us polio vaccines to go to the villages and immunize children. In my experience, we were usually given more vaccines than the number of children in the villages we were supposed to serve. And so what will happen is that sometimes you have vaccines that's supposed to immunize about 50 children, but you go to the village and there are only 20 children in the village. The challenge here was that when you immunize the 20 children and return the leftover vaccines, supervisors will start to blame us, saying we did not work. And that comes with a lot of consequences. One, they may not pay you the full amount of money they're supposed to pay. And then two, they will not invite you for future programs. But as you know, sometimes the small monies we get from these programs is what we use to support our families. And so here I am one time during this national immunization program where they've given me vaccines that's supposed to immunize 50 children, and I was in a village. And I combed around the entire village, and there were only 20 children, and I immunized all the 20 children. And then after this, I was having a challenge, a difficulty, as to whether to return the leftover vaccines or to pour the vaccines away and record the number of children they expected me to immunize. Given the financial difficulties and given how much I didn't want to lose the total amount they're supposed to pay me, and I also didn't want to lose the opportunity to be invited for future health programs. So at the end, I decided to pour the vaccines away and go back and report the number the supervisors wanted to hear. This is an experience I wasn't very proud of, and I felt very bad because I know vaccines cost money, and I also know the same vaccines I was pouring away could be used somewhere else. Yet, because of the pressure for numbers from supervisors, I had no choice but to pour these vaccines away. What I am calling for today, and what I hope our supervisors and the people who work with community health workers will recognize, is that numbers should not be used to determine how much money or what incentives we get as community health workers. If you put more pressure and decide to use numbers to determine who works and who doesn't work, to determine which community health worker to invite back for a program and who not to invite, to determine how much to pay community health workers, then at the end of the day, this pressure will result in numbers that have no meaning, numbers that does not reflect the work we do, and that does not help public health decisions. And so I think going forward, Supervisors and health officials should be willing to listen to explanations from community health workers, especially in scenarios where community health workers are given a number to reach, and if they are not able to reach that number. Public health officials should be willing to listen to such community health workers and willing to understand and not to penalize them. And so using numbers to determine incentives is causing more harm than good. Thank you.